My name is Laura Erskine. I am the program director of the MPH program in Health Policy and Management. I'm also faculty in the Department of Health Policy and Management and co-director of the Center for Healthcare Management. So the program has two tracks. You can do an MPH in healthcare management, or you can do an MPH in health policy. And depending on which track you choose, your career path might look a little different. Those people who are in the healthcare management track often go into hospitals and other sorts of delivery settings where they work as project managers, as administrators, as any sort of non-clinical leader. Some of our management students also go to the payer side, so working for insurance companies or working for consulting companies. A smaller portion in the biotech, pharma, startup space. On the policy track, there's really sort of two main paths. One is working for some sort of government agency or healthcare entity, something like the Department of Healthcare Services or Health and Human Services at the federal level. Or students go into sort of an analyst role for potentially an advocacy organization or a policy consulting firm. And so, depending on who you are, generally, you have an idea of whether you are more policy or more management oriented. So because the MPH is a professional degree, one of the things that we want to take into account is work experience. And so students should be looking for internships, for part-time jobs, for full-time jobs in the healthcare space, if possible. Also, as you apply and as you go through the application process, there are a number of different components. So one thing to start looking for early are letters of recommendation. We require 3 letters. So 2 letters need to come from faculty members. So those of you who are still in school, think about which faculty members you might want to develop more close relationships with. Also, students are required to write a personal statement, and that personal statement is thinking about why, not only why the MPH, but why in the Department of Health Policy and Management. So unlike some graduate programs where the admissions are done at the school level, at the School of Public Health, we admit students at the department level. So we want to know specifically which one of those 2 paths, the policy path or the management path, you're interested in. And then finally, we have one deadline a year. So applications are due on December 1st, and there can be some delays in getting transcripts and those sort of things approved. And so you want to apply as early as you can. A little more than 85% of our students are getting some sort of financial support from UCLA. That could be scholarships, it could be fellowships, it could be TA or graduate research assistant positions. And the average financial support per student is a little more than $25,000. And so there are also loans available. Not that many of our students take out loans because most of them can sort of get by with the scholarship and other types of financial support that we offer. This year, the Department of Health Policy and Management provided $1.5 million to the students that are studying in our MPH program. So I think the most popular question I get is, what's the difference between an MPH in healthcare management and an MHA? So an MPH is a master in public health. And that's really the key element, is that regardless of what department in the School of Public Health that you're in, all of the students are getting a grounding and a foundation in all 5 of the public health departments: biostatistics, community health sciences, environmental health, epidemiology, and health policy and management. An MHA is a master's in healthcare administration. And so in that program, you are probably not in a school of public health, and therefore not exposed to the material from the other disciplines and other departments. So an MHA is strictly healthcare management. An MPH is a little bit broader because it incorporates some of the elements of public health. I think the second most popular question is, sort of what characteristics or qualities are desirable in potential students. And I think one of them I mentioned earlier, which is some work experience, and specifically if that work experience is in healthcare. But in addition to that, we're looking for sort of passion and curiosity about the healthcare field and the healthcare industry. We're looking for strong interpersonal skills. This is a professional degree, and a lot of the work is done in teams. There's a required internship, and so we want to make sure that we have people that are really going to work well with others. We do look at your grades. So, we do want some confidence that you are going to do well academically in the program. And, any evidence of leadership or other types of achievements, whether it's through extracurricular activities, sports, clubs, anything like that that can demonstrate that you have some leadership potential. So those are the 2, I think, most popular questions I get. We have a website, hpm.ph.ucla.edu. And that website has all kinds of information about the application process, about the curriculum, about activities that students can get involved with once they're part of the program, about internships, about where our graduates go. And so that's really sort of your one-stop shop for all MPH in health policy and management information. So I'm going to share some advice that I think applies to any graduate program that you do, whether it's ours at UCLA or somewhere else. And that is to be engaged. I think one of the biggest differences between graduate school and undergraduate education is the importance of what happens outside of the classroom. So while your classes are important, there are all kinds of professional development activities, whether it's networking, whether it's workshops, whether it's speaker series. And I really would encourage all of you to be engaged, to get involved, and to really take in as much as you can of the experience. The 2 years flies by, and you don't want to finish with any regret. Go Bruins!